Today class, we are going to take supragingival and subgingival irrigation. What do you mean by supragingival and what do you mean by subgingival? Because if that detail is like supragingival, things like supragingival means the irrigation above the top of the gingiva. Subgingival irrigation means the irrigating the inside the subgingival area. What is the main action or function of this related to periodic fibers? Because it's the main transferring antimicrobials agents reducing the gingival inflammation. So this is one way of local drug delivery, like drug can be directly to the gingival area or drug can be indicated from the supragingival area. So there are many irrigation devices. One is supragingival irrigation and one is for subgingival irrigation. And the oral irrigation is shown to what is disrupt and detoxify the subgingival plaque, because when you irrigate the pressure, the microbial agent and things like that, so it disrupt and detoxify the subgingival plaque. And as provided, it is also useful in delivering antimicrobial agents into the periodontal pocket. You can see the different diagrams there. So it has a reduction of 39% and 71%. In periodontitis, it is 44 to 68% mainly subgingival irrigation. In some cases, supragingival. In subgingival, it shows up to 90% reduction in periodontitis, mainly in the localized area. And local drug delivery, 72% to 93%. And mouth rinsing, it reduces around 4%. So this is an engine to scaling and root planing, and it also improves oral health. The thing is that you do scaling and root planing, it's an engine, like you adding some other agent for scaling and root planing, that will improve gingival health. And it's used in two distinct ways. One is a therapy phase and one is a maintenance phase. Like in therapy phase, it is used mainly the antimicrobial agents are injected locally than the systemic medication. So therapy phase is used, and as a maintenance phase, we discussed earlier in our treatment plan classes, phase 1 therapy, like phase 2, phase 3, phase 4 is a maintenance phase. So maintaining the oral agent towards subgingival or supragingival irrigation is done. And in that, two methods I use. One is a professionally delivered irrigation, that is we do it with the patient comes to clinic, we do the local subgingival or supragingival irrigation to the patient. And one is home or self-applied irrigation that the patient does by himself or herself at their house. Advantage and disadvantage for both. Professionally delivered irrigation, that the dentist check all the areas and do it thoroughly, and the results are better. But the disadvantage is that the patient can't go to a dentist and for the professionally delivered irrigation for doing the same procedure every day. Patient can't go to the dentist. That is the problem. Home or self-applied irrigation, the main advantage is that patient can do it by himself or herself at their houses, and no need to go to a dentist, so they can do by themselves. The disadvantage for that is the main problem is that it is for 2 or 3 days, that you feel irritated or things like that. You will stop it and you won't put all areas, you will be just doing it. So the results wise, it doesn't give much good result. So professional delivered irrigation is otherwise called as chairside delivered irrigation, and mechanical debridement of the periodontal deep pocket is incomplete and does not completely remove the residue subgingival biofilm or mechanically. Okay, you remove all the subgingival calculus. So you do that. But certain amount of some calculus residual subgingival biofilm will be present. With antimicrobial irrigation, the main advantage is that the bacteria left behind could be eradicated and better results are obtained after scaling and root planing. So, if you do scaling and root planing, then you so mainly three factors are there for the efficacy. One is the penetration of the chemical agent, one is the concentration of the chemical agent, and the duration of the chemical agent which you are using. So these are the main advantages for the professionally derived chair side. And what do you mean by penetration? The agent must be able to penetrate to the base of the pocket to reach the periodontal infection or to disrupt the biofilm. The concentration of the agent must be sufficient concentration that it should be either bacteriostatic or it should be either bactericidal. Third is the duration. The agent must maintain concentration for sufficient duration to be effective against biofilm because your GCF and your saliva, everything is present. So the agent must be able to, like chloroxine has a substantivity of 2 levels, it must be able to maintain the concentration against the biofilm for some time. To penetrate the pocket, a blunt cannula is used using hand syringe or mechanical device placed 1 to 3 millimeter into the gingival surface of ground pocket, and the penetration ranges from 70 to 95%. There are two types of cannulas I use mainly. The two types of cannulas are one is a side port cannula and one is an end port cannula. End port cannula you will be knowing that your normal syringe, you know the cutting. So there is an end port. The opening comes at the end. And side port is mainly used for endodontic irrigation and in canals. The opening of the cannula will be on the side, not in the end. If it is cannula is in your syringe, the opening will be here, and the other thing, the opening will be on the side area. So that is a side port cannula and end port cannula. Side port has the lowest ejection pressure because you won't be able to inject it directly because the fluid pressure comes and goes straight and it has to bend. So you got to give more pressure, and also the presence of calculus. Subsidiary, if there is calculus present, will impair the penetration to deep periodontal pocket. You can see the diagram here. The first one is the end port cannula, and side port you can see a small hole here on the side port that's mainly used for endodontic your root canal irrigation. And the concentration of agents used cannot be effective on cells in biofilm, but the effectiveness was reduced or inactivated when in contact with blood components in the pocket. And the flushing action of the GCF because of the upward flow and washout of agents and half-life of agents used to subjectively is 13 minutes. The main problem is that because the GCF flow, the agents comes out in blood components in the pocket, and sometimes the half-life of all these agents is approximately 30 minutes. The main agents used are chloroxine, I use chloroxine chips and things like that, chloroxine irrigation use, tetracycline, stannous, fluoride, coordinate. These are the main agents used for subgingival or supragingival irrigation. It's a home or the self-applied irrigation. These are designed by a dentist and patient engineer developed in 1960s. The trials failed due to the limited ability to reduce plaque, but evidence showed reduction in gingivitis, bleeding on probing, and periodontal pathogens. And latest studies that home irrigation stimulates post-modulation because we do it clearly and thoroughly. It helps in reducing it. It stimulates the post-modulation effect. These are the various things available in the market. The first one, the left side, the blue one is a water tip which is available in India. It is designed in America. That thing that bottom thing you fill it with water or your chloroxylin or whatever it is, a chemical agent. The tip is there. There is a button here. You can see a front portion, white area, top blue button is there. To start the irrigation side, a small battery of red water comes. So the irrigation side, you can move it around your full mouth and you can irrigate it. Other than the modification of the deposit diagrams. So the problem is that patient will be drenching by himself because the water will be coming out of the. So they can use it in the bathroom and things like that. So it will be not a problem for them. The mechanism of action is a direct application of a pulse or steady stream of water or other solution. Once you switch it on, the direct irrigation, the water stream of water comes, and the pulsation provides for a compression and decompression phase, which clears the bacteria from the body. The pulsation, like for every action, there is an equal and opposite reaction. The pulsation, there is a compression and the decompression, which clears the bacteria. So you get that because of the once the compression comes and it comes out, the decompression clears the bacteria from the body. Normally irrigated with 1200 pulsations per minute on a medium to high pressure setting of 50 to 90 ounces per minute. That is the minimum pressure, 1200 pulsations per minute. So it is a slowly moving one, but with a steady stream and direct application of steady stream and pulse flow. And this pressure or this water pressure creates two zones of hydrogenetic activity. What is the impact on that the solution contacts the area. The solution enters, it contacts the area. Then second is a flushing zone. The solution reaches the subgingival sulcus and outcome is subgingival penetration. First is the impact, that chemical first go and touches there, and second the flushing action. So it the subgingival irrigation and wound penetration comes. And there are mainly two tips. One is the standard jet tip, and other one is a soft site specific subgingival tip. But other tips are available, but does not show subsequent result. These two are the standard tip is a straight one, and the site specific is a subgingival tip. It has a small curvature in the end, like the scalar tips. Irrigation with standard tip is called a supragingival because it cannot go deeper. And the point of delivery is a coronal to the gingival margin, resulting in a penetration of the solution. The subgingival sulcus by only 50%, just irrigated the supragingival area. It is used for full mouth irrigation. You can irrigate it in all areas. And irrigation with soft site specific tip is called subgingival irrigation. Its placement of the tip is below the gingival margin. You place it into the pocket of the gingival sulcus, and mainly used for localized irrigation of site specific deep pocket of irrigation or implant or crown and bridge. And the safety concern, the concerns about the safety, soft tissue damage, penetration of bacteria, but no scientific evidence has been introduced. Only concerns that you inject the pressure or you apply pressure, so the bacteria goes deeper into the tissues and create further problem. And even soft tissue damage, but the scientific evidence has not been proved. In few cases, maybe because they are not using it properly, few cases reported. But you should always take into consideration the patient overall medical and health status. If the patient is having so many other medical issues or systemic illness, don't go for this. And consultation with patient physician is must to assess the risk and clinical judgment. Because so many patients will be taking so many other medications like anticoagulants or for depression or stress. So many other medications will be taken by so many patients. So you have to get the patient's physician's consent before proceeding with the further treatment. And the clinical outcomes of this professionally developed or home irrigation, there is reduction in plaque, obvious reduction in plaque, calculus and gingivitis, bleeding and probing depth reduction, reduction in periodontal pathogens and inflammatory mediums. There is a good result because subgingival irrigation, supervising irrigation, there is reduction in plaque, reduction in calculus, reduction in gingivitis, reduction in bleeding and probing pocket depth reduction, reduction in periodontal pathogens and inflammatory mediums. So already altogether you get a good result. We can be used as a periodontal maintenance because after surgical management things like regular periodontal maintenance, this can be used, and even patients with orthodontic appliances because so many plaque accumulation food will get stuck in between the orthodontic brackets and wires. It can be used for cleaning the orthodontic appliances. Even maxillary fixation appliances will be there after trauma, like even orthodontic management fixed appliances will be there. So that can be used even crown and bridge. Sometimes some areas of the crown and bridge in the pontic area it could get accumulated. For implants, it is easy because there is no trauma associated. We are not using metal instruments. And diabetic patients, the ginger will be so soft, vulnerable, and things like that. So it can be used in that. Compliance is one of the major concerns because no one likes to get wet, right? So you can do it in the bathroom, you are taking bath or things like that. So irrigation everywhere, the water flow is there everywhere. So compliance by the patient is one of the major consideration. And these are the fluorescein dilation. It's shown effective in clinical trials. That is usually what is available in the market is 0.2% and 0.12%. 0.12 is mainly for period, 0.2 is regular mouthwash. So the concentration of 0.02, to get that concentration to one part of 0.2 fluorescein percentage, you add 5 parts of water. So you get 0.02%. It's based on a fluorescein 0.12%. So to get 0.4, you add 1 part of fluorescein, 2 parts of water. And to get 0.06% of concentration, you add 1 part of water to 1 part of fluorescein. That is based on 0.12% of fluorescein. This concentration 0.02, 0.04, 0.06 show effective in clinical trials. This oral irrigation covers 2 treatment modalities for the prevention of periodontal disease. One is professional irrigation, that is very limited value, and self-applied irrigation is accepted in majority of the patients. Professional irrigation, the problem is that everyday patient can't do this and do the professionally applied irrigation. And it will be expensive. You go to a dentist, they do that, it will be expensive also. So once you purchase that water tip or things like that, self-applied patient applied by himself, self-applied irrigation is accepted by majority of the patients. The majority of the patients willing, or it is easy for them to, they can use it in their convenience. The time permits, they can use it according to their convenience. That is accepted. So main advantage is that it is atraumatic. This wind up to the beginning. So mainly supragingival and subgingival irrigation, and it is helps in disrupt and detoxify subgingival plaque and can be used for delivering antimicrobial agents in the periodontal pockets. So you can see the difference in supragingival irrigation, subgingival irrigation. The reduction in gingivitis is 29 to 71, 44 to 68. Subgingival periodontitis it is 75 to 93, and gingivitis it is 90%. But mouth rinsing only helps in 4%. So this is better than normal mouth rinsing. There are 2 distinct phases. One is therapy phase and maintenance phase. Therapy phase professionally and home or self-applied irrigation. Maintenance phase is the usual maintenance by the patient. It's a chair set and depends on the 3 factors: penetration of the medication, concentration of the medication, and duration of it lasts in the oral cavity. What is that? Agent must be able to penetrate to the base of the pocket to reach the periodontal infection. The concentration must be sufficient concentration that it should be either bacteriostatic or bactericidal. An agent must maintain a concentration of sufficient duration to be effective against biofilm. And 2 port canvas are there: side port and end port. The end port is usually our normal syringe. So the opening will get then, and the side port which has a lowest ejection pressure because it has to come, and the calculus is there. It imbibes. And the problem with the effectiveness of the subgingival irrigation is that because of the GCF flow, then washing out of the agent, the half-life mainly subgingival agents are 30 minutes. Mainly subgingival irrigation use the chlorhexidine, tetracycline, stannous chloride, and povidone. And home applied irrigation also helps in post-modulation effect. And the pulsation, because in home application, we have the compression and decompression, 2 zones of heterogeneity activity. What is the impact from the drug? reaches the site contacts area, then the flushing of the solution reaches subgingival sulcus and subgingival penetration. Two types of tips, standard jet tip, soft and site specific. These are this shows mainly effectiveness used for full mouth irrigation. And irrigation with the softer side, it is called as subgingival irrigation. Is beneath the gingival margin. And safety concerns there, but not much evidence are there. If any patient has any apprehension, always consult the patient physician. And there is a clinical outcome is obviously reduction, plaque, calculus, injury, probing, pocket, reduction, bleeding on probing, reduction, on pathogens. It can be used in orthodontic appliances, macular fixation, crown and bridge implants, that in all patients. And the patient complaints is of the major consideration. And the dilation 0.2, 0.0, 2.0, 4.06 based on 0.12% of fluoride stain. And professional, limited and expensive self-irrigation is accepted by major of patients. So, thank you. We will see you in the next class.